Good afternoon. My name is Sheila Hardesty, and I have been working on a video for one of my classes in my bachelor's program at Davis and Elkins College. We did try to film this the other evening, and we had technical difficulties, as you all know. First, I'm going to tell you a little bit about myself. I'm a registered nurse at Garrett Memorial Hospital. I also work per diem at Oakland Nursing Rehab Center. And I'm taking the bachelor's program through Davis and Elkins College to further my education and career. I had to prepare a PowerPoint presentation, and I needed to present it to someone, so I'd like to introduce my audience. This is Donald, my lovely granddaughter Kiera, and my handsome grandson Thomas. So we'll watch the presentation, and then you all can let me know what you think. You want to turn that on, Thomas?
Today I would like to talk about the utilization of power in professional nursing. Nursing power allows nurses to act independently while practicing as a profession. Nurses must utilize power within their reach to be true patient advocates. The nursing profession as a whole establishes power through the practice of individual nurses who are engaged in patient care, administrative leadership, teaching, and research. When power is absent or not utilized, others are more likely to step in and decide what nursing is and what nurses do. When a nurse provides excellent care in a professional manner, she gains the respect of her patients, her co-workers, supervisors, and physicians. Because nurses spend considerably more time with the patients, physicians will often ask experienced nurses for their assessment findings of their patient's conditions and consider their recommendations of what or how interventions need to be provided before giving new orders. The power of clinical nursing is significantly enhanced by the therapeutic interpersonal relationships nurses establish with their patients and families. This statement stands strong whether the nurse is working in acute care, critical care, emergency care, mental health care, rehabilitative care, or long-term care, end-of-life care, or a specialty care unit. Always explain and educate your patients and families on risks versus benefits. Always remember patients have the right to make choices involving their plan of care. Surgery versus no surgery, depending on their age and their current health care status, rehabilitation time frames, and what the expected outcome of their choices may be. A professional nurse should always educate their patients on topics such as fluid and dietary intake, medications and procedures, sugar or carbohydrate intake and the risk for diabetes or managing diabetes, increased fat intake and the risk for high cholesterol and heart disease, smoking and tobacco use and the risk for cancer and heart and lung diseases, as well as many other topics. Using power to help develop the novice or beginner nurse become an experienced expert nurse offers instructors, leaders, and managers a way to promote an individual nurse's practice to a professional nursing career. Nurses who take advantage of tuition reimbursement offers and grants to further their knowledge base have the opportunity to advance their professional career, ultimately improving patient and family care and patient outcomes. Power is important at the individual level and translates into greater power for nursing departments and nursing as a whole. Of course, with power comes responsibility. Nurses take on significant decision-making responsibilities due to the information they have about their patients, even when the decision-making is not necessarily sanctioned by a healthcare manager, supervisor, or physician. It is the nurse's responsibility to make all decisions as a loyal patient advocate. Documentation must be clear, concise, accurate, and professional. Remember, the medical record is a legal document. Nurse case managers need clear, concise documentation documentation to show patient progress and patient comfort, thus meeting the criteria for reimbursement and for continuation of care and treatment. Healthcare organizations continue to increase professional responsibilities of nurses, yet remain slow in recognizing nurses as autonomous professionals. Ironically, within healthcare organizations, formal power is often proportional to time spent away from patients. Nurses at times experience feelings of frustration when formal organizational constraints seem to work against quality patient care. Costs or budgets often hinder or delay the quality of patient care delivery. It is the nurse's responsibility for documentation of care, and nurses spend hours on documentation. Insurance companies, Medicare, Medicaid, or Obamacare will only pay for certain medications, treatments, and procedures, or they will limit the time they will pay and only pay if all patient criteria are met. Once again, clear, accurate, concise documentation is often the key for repayment. These reimbursement companies will only pay for specialty care or rehabilitative care for a limited time and may require more documentation be submitted daily or even weekly to continue treatment and reimbursement. Nurses who have developed a powerful nursing practice acknowledge their unique role in the concept of patient and family-centered care. They commit to continuous learning through education, skills development, and maintaining an evidence-based practice. They demonstrate professional conduct and recognize the critical nature of their behavior. Nurses value collaboration and partner effectively with colleagues in nursing and other disciplines for the best possible patient outcome. Nurses actively position themselves to influence decisions and resource allocation. They strive to develop an impeccable character, to be inspirational, compassionate, and have credible, sought-out perspective. Nurses recognize that the role of the nurse leader is to pave the way for nurses' voices to be heard and to help beginner or novice nurses develop into powerful, experienced professionals. They evaluate the power of nursing and the nursing department in the organizations they enter by assessing the organization's mission and values and its commitment to enhancing the power of diverse, assorted perspectives. The power of every individual nurse impacts patients and families, organizations, interdisciplinary colleagues, and the entire nursing profession. Professional nurses need to utilize power by continuing their education and thus advancing their careers. 9.6% of the U.S. population is a nurse. That's approximately 100 out of every 10,000 people. Remember, there is power in numbers. Just imagine if all nurses stood together politically as a whole, what this would mean for healthcare. Without power, there is no action. We're excited as follows. Thank you, and please take time to review references used for my presentation.
Okay, as you can all see, I do get a little tongue-tied and nervous, and my goal is, when I'm finished this course, that I'll be able to prepare and present a presentation, and it will flow smoothly, and I'll feel comfortable while presenting it. Do you all have any suggestions as far as my presentation? How about you, Kier? See, someday when you're in college, your old grandma can help you. Do you think that'll happen? Once again, thanks.